Welcome to Healthy Care, your trusted source for essential health knowledge and tips to lead a happier, healthier life. Did you know that your liver is one of the hardest working organs in your body? It's like a 24/7 powerhouse, processing everything you eat, drink, breathe, or apply to your skin, while performing over 500 vital functions that keep your body running smoothly. But when this vital organ starts to struggle, the consequences can be life-altering and in some cases, even life-threatening. In today's video, we'll uncover 16 crucial warning signs that your liver might be in trouble. Some may seem minor at first, but recognizing these early red flags could save you from severe complications down the road. Whether it's unexplained fatigue, changes in your skin, or subtle shifts in your body, these symptoms are your body's way of signaling for help. Stay with us as we dive deep into these signs, explaining why they occur and what steps you can take to protect your health. And don't forget to hit the like button, subscribe to Healthy Care, and turn on notifications so you never miss a single life-changing tip. Your health is your most valuable asset. Let's make sure you protect it together. 1. Severe fatigue and weakness. One of the first signs that something is amiss with your liver is a profound sense of fatigue and weakness. No matter how much you rest, making it difficult to perform daily activities. The liver plays a crucial role in energy metabolism. When it's failing, your body can't effectively convert nutrients into energy, making you feel tired and sometimes nauseous. Also, when the liver fails, toxins build up in the bloodstream, which can lead to feelings of lethargy. If you often feel tired lately, make sure to get enough rest, stay hydrated, and eat balanced meals to boost your energy. Avoid sugar, salt, and fat, which can put more strain on your liver. 2. Loss of appetite and nausea. A significantly reduced desire to eat, frequent feelings of nausea, and unintended weight loss can also signal liver failure. The liver plays a key role in metabolism, and when it fails to function, our bodies can't process nutrients properly. Then toxins can build up, leading to a reduced appetite. Loss of appetite can also stem from the discomfort in your belly caused by liver inflammation. Also, liver failure can come with a bigger or enlarged liver. It can press on the stomach and other organs, creating a feeling of fullness and nausea. Sometimes it comes with abdominal pain and fatigue. Staying hydrated, drinking ginger or peppermint tea, and consuming bland foods can help ease nausea. Try eating small, frequent meals and nutrient-packed snacks to boost your appetite. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 3. Abdominal and shoulder pain. People with liver disease can have general pain similar to anyone else, like back or knee pain. More than 80% of those with cirrhosis, a condition in which scar tissue replaces healthy liver tissue, report pain. One report found almost 95% of people with end-stage liver disease experience pain. The liver doesn't actually have the nerves that sense pain, but liver disease can cause specific pain. One reason is that in liver failure, the liver's increased size can press against surrounding tissues, resulting in dull abdominal pain. The pain can also be due to inflammation in tissues surrounding your liver. This often manifests as nagging pain on the right side of the abdomen, below the rib cage where the liver is located. Sometimes the pain can radiate to the right shoulder, and even up to the neck. Also, the pain in your joint or muscle may suggest hepatitis or liver inflammation from drugs or viral infection. We've explored the 3 early warning signs of liver damage. Ignoring these symptoms can lead to the condition advancing into more severe stages, bringing with it additional, more alarming signals, each one a potential lifeline if recognized in time. This section will uncover these critical indicators, so don't miss out. If these warnings are overlooked and treatment is delayed, it may leave you facing a dire situation where a liver transplant becomes the only option for survival. However, liver transplants are not only fraught with medical challenges, but are also notoriously hard to secure, regardless of financial resources. In most parts of the world, organ waiting lists are heartbreakingly long, forcing patients into a race against time that many tragically lose. This grim reality has fueled a dark underbelly in the global organ trade, a stark truth we are committed to exposing. In China, some hospitals advertise unbelievably short waiting periods, claiming to match organs within weeks or even days. Such expedited availability raises profound ethical questions, as investigations have uncovered a disturbing network of forced organ harvesting. As a 2016 testimony to the U.S. Congress estimated that China performs 60,000 to 100,000 organ transplants annually, primarily sourcing organs from detained Falun Gong practitioners, individuals who live by the principles of truthfulness, compassion, and forbearance. Other victims include Uyghurs, Tibetans, Muslims, Christians, and members of other persecuted minority groups. These individuals are subjected to medical testing, and their organs are harvested to fuel a billion-dollar transplant industry, a practice endorsed by Chinese authorities and medical institutions. Despite condemnation from the United Nations and numerous countries, this heinous crime has persisted for over 25 years. By bringing this issue to light, we hope to uphold the principles of medical ethics and educate our audience to avoid unwittingly supporting such practices. Acting early is crucial, not only to prevent the immense physical and financial burdens of liver failure, but also to sidestep the moral and ethical dilemmas it can entail. Now, let's move on to the 13 advanced warning signs of liver disease, each of which provides an opportunity to take proactive steps while treatment is still effective. Remember, these symptoms cannot be resolved at home, so seeking timely medical attention is essential if you experience them. 4. Poor vision. Liver failure can impair bile production, which is essential for digesting and absorbing fat-soluble vitamins, including vitamin A. A deficiency in vitamin A can cause night blindness, making it difficult to see in low light. Prolonged deficiency may lead to xerophthalmia, a serious eye condition that can result in complete blindness. During eye exams, doctors may notice white or yellowish spots on the retina, which can indicate severe liver disease like cirrhosis. Portal hypertension may also damage the retina, affecting vision. 5. Spider veins. Spider angiomas. Spider angiomas, or small spider-like blood vessels under the skin, are common in chronic liver disease. They are typically found on the face, neck, forearms, hands, and upper chest. These blood vessels are linked to hormonal imbalances caused by liver dysfunction, particularly increased estrogen levels. Avoiding alcohol can help prevent the condition from worsening. Although spider veins themselves are not harmful, they may indicate severe liver damage and should prompt medical evaluation. 6. Low urine output. More than 50% of patients with acute liver failure experience significant kidney problems, including kidney failure. Advanced liver disease affects blood flow to the kidneys, particularly in cases of portal hypertension, where blood vessels leading to the kidneys narrow. This results in decreased urine output and poor kidney function, which can worsen rapidly without intervention. A liver transplant is often necessary to restore kidney function. 7. Shortness of breath. Breathing problems are rare in the early stages of liver failure, but may appear later during recovery, or as a result of complications like hospital-acquired infections or aspiration. In portal hypertension, fluid buildup in the abdomen can press against the lungs, making it harder for them to transfer oxygen into the bloodstream. This can cause shortness of breath, with symptoms like blue lips or fingertips. Shortness of breath in patients with cirrhosis often signals advanced disease and may indicate the need for a liver transplant. 8. Vomiting blood. Portal hypertension, caused by liver failure, can lead to swollen and enlarged veins, varices, typically in the esophagus or stomach. Scarred liver tissue blocks normal blood flow, increasing pressure in these veins, which can cause them to rupture. If this happens, significant bleeding may occur, and the blood may appear in vomit or look like coffee grounds. This is a medical emergency that requires immediate treatment to stop the bleeding and prevent future episodes. 9. Easy bruising and bleeding. The liver produces clotting factors that are essential for stopping bleeding. When the liver is failing, the production of these factors declines, disrupting the blood clotting process. This results in an increased tendency to bruise easily from minor trauma and prolonged bleeding from cuts. Portal hypertension and swelling from liver failure, especially cirrhosis, can worsen clotting problems by diverting blood flow to other areas. If you notice spontaneous bruising or bleeding without any injury, it's essential to consult a doctor. To support your body, avoid activities that could lead to injury. Adding vitamin K-rich foods, like leafy greens and natto, to your diet can give your clotting system a natural boost, but medical evaluation is still critical. 10. Fluid retention and swelling edema. Fluid buildup occurs when the liver fails to regulate sodium and water balance. Often due to portal hypertension, a condition where blood pressure increases in the veins that supply the liver. This can cause swelling in the abdomen, ascites, and legs. Low albumin levels. another result of liver failure, contribute to fluid leakage into surrounding tissues. This can make the stomach appear swollen or large, even in thin individuals. Managing fluid retention involves a low-sodium diet and, in some cases, diuretics, but treating the underlying liver condition is key. 11. Very itchy skin pruritus. Persistent itching, especially on the palms and soles, is a common symptom of liver failure. This occurs because bile flow is impaired, causing bile salts to build up in the bloodstream and deposit in the skin. The itching often worsens in the evening and may be triggered by heat, menstrual cycles, or synthetic fabrics, but like allergic reactions, pruritus from liver failure usually doesn't cause visible skin changes. However, excessive scratching can lead to secondary skin problems. Keeping skin hydrated, using menthol-based lotions, and taking cool baths can provide temporary relief, but medical treatment is essential. 12. Muscle loss and twitching. Muscle loss sarcopenia is common in chronic liver failure, especially in cases of cirrhosis. This happens because the liver can't process nutrients properly, forcing the body to use muscle for energy. The high ammonia levels also contribute to muscle loss and can cause involuntary twitching or jerking, known as myoclonus. Over time, muscle loss can lead to malnutrition, weakness, and mobility issues. Resistance exercises like lifting light weights can help, but severe cases often require nutritional support. Symptoms like muscle stiffness, tremors, slow movements, or slurred speech may indicate advanced hepatic encephalopathy. 13. Foul breath photohepaticus. A failing liver can result in a distinct musty or sweet odor on one's breath, known as photohepaticus. This happens when the liver is unable to convert ammonia into urea, leading to higher levels of ammonia and other odorous compounds like dimethyl sulfide in the blood. These compounds are excreted through saliva, causing the bad breath. Maintaining good oral hygiene and staying hydrated may help, but the underlying liver condition requires medical attention. 14. Confusion and mental changes. Hepatic encephalopathy, or liver acts as the body's main purifier, removing toxins from the bloodstream. When the liver fails, toxins accumulate in the brain, causing hepatic encephalopathy, a medical emergency. In the early stages, symptoms include confusion, slight personality changes, clouded judgment, and disrupted sleep patterns. Patients may also experience anxiety, depression, or irritability and find it difficult to concentrate. As the condition progresses, confusion and lethargy increase, often accompanied by drowsiness and disorientation. Severe cases can lead to muscle twitching, restlessness, and even coma. Early detection is critical for proper treatment. 15. Dark urine and pale stools. The buildup of bilirubin not only causes jaundice, but also changes the color of urine in stools. Ideally, urine should be clear or light yellow. If it darkens, it often just means you need more water, but if it stays dark for several days, it could indicate liver problems. Dark urine results from too much bilirubin being filtered by the kidneys. It may resemble tea or cola in color. The normal brownish-yellow color of stools is due to bile, which is made from bilirubin. When the liver is damaged and can't produce enough bile, stools can appear pale. Black, tarry stools, on the other hand, could indicate internal bleeding, a serious issue that needs immediate attention. 16. Yellowish skin and eyes jaundice. Jaundice is one of the most recognizable signs of liver dysfunction, marked by a yellowish tint to the skin and the whites of the eyes, sclera. This occurs when there's an accumulation of bilirubin, a byproduct of red blood cell breakdown. A healthy liver processes bilirubin and excretes it in bile, a fluid that helps you digest food. When the liver is damaged, bilirubin builds up in the bloodstream and ends up in other tissues, resulting in yellow skin. Doctors often suggest a bilirubin blood test when jaundice appears. Normally, bilirubin levels in the blood are under 1 milligram per deciliter. But yellowing of the eyes becomes noticeable when levels exceed 3 milligrams per deciliter. If levels continue rising, the skin may turn from yellow to green. Jaundice is more common in newborns and the elderly, and often points to liver conditions like hepatitis, liver inflammation, sepsis, a body-wide infection, or cirrhosis, scarring of liver tissue. If only your skin turns yellow but not your eyes, it's more likely to be keratoderma, a harmless condition caused by eating too many carotene-rich foods like carrots. Understanding the warning signs of liver trouble is the first step to taking control of your health. Remember, your liver works tirelessly to keep you healthy, but it also needs your care and attention. By staying informed and acting early, you can prevent minor issues from turning into serious complications. If you found this video helpful, don't forget to give it a thumbs up and share it with someone who might need this information. And for more life-saving tips and health advice, hit that subscribe button and turn on the notification bell so you never miss an update from Healthy Care. Thank you for watching, and as always, take care of yourself and your health. Together, let's make health a priority. See you in the next video. 6 food-related symptoms suggesting liver trouble. I must emphasize the criticality of liver diseases, including cirrhosis and liver cancer, which are leading causes of mortality worldwide, accounting for approximately 2 million deaths annually. These diseases can be insidiously asymptomatic in their initial stages, making early detection challenging. When symptoms do become apparent, it often indicates that the disease has progressed to an advanced stage. It might be surprising to learn that early indicators of liver dysfunction can occasionally be identified through changes in the lower extremities. Seemingly minor or unrelated symptoms in the legs could serve as early warning signs of a liver condition. This video we will provide an in-depth analysis of these symptoms. Our goal is to empower viewers with knowledge to recognize these early signs, thereby enhancing awareness and facilitating proactive measures for liver health preservation. Sign number 1, unpleasant foot odor. Unpleasant foot odor is often perceived as a simple hygiene issue, but it can actually be a telltale sign of deeper health concerns, particularly in relation to the body's toxin elimination processes. Our skin is not only a protective barrier but also plays a vital role in expelling toxins, primarily through sweat glands. These glands are instrumental in releasing toxins and metabolic byproducts, especially when the kidneys are underperforming. In cases where kidney function is compromised, the body attempts to compensate by enhancing toxin excretion through the skin. This intensified process can lead to a distinct and unpleasant foot odor. The health of the liver is closely linked to this occurrence. It is important to understand that all organs in the body are interconnected. Thus, a disorder in the liver is likely to impact other organs, such as the kidneys. Liver diseases, known for causing toxin buildup and impairing blood circulation, can adversely affect the kidneys and other organs. Therefore, an unpleasant foot odor should not be overlooked, as it might indicate underlying liver issues, signaling the body's increased dependence on skin excretion mechanisms due to compromised liver and kidney functions. Sign number 2, nail fungus. Nail fungus, or onychomycosis, is a condition identifiable through specific changes in nail appearance, such as discoloration, rough texture, splitting, loss of shine, presence of white spots, or flaky skin around the feet. These symptoms may not only indicate a fungal infection but could also point to underlying liver health issues. The link between nail fungus and liver health is substantial. Individuals with compromised liver function often experience an imbalance in their gut microbiome, which can manifest in various conditions, including nail fungus and other skin-related issues like dandruff and seborrheic dermatitis. A significant study published in 2009 in the Journal of the European Academy of Dermatology and Venereology highlighted the increased prevalence of nail fungus in individuals suffering from liver cirrhosis and viral hepatitis B and C. This correlation emphasizes the need to view nail fungus not merely as a cosmetic concern but as a possible indicator of more serious health complications, particularly those related to liver health. Recognizing and addressing nail fungus may provide critical insights into an individual's overall liver function and general health. Sign number 3, erythema. Erythema, defined by its characteristic skin redness, can be a crucial indicator in the evaluation of liver health. While it's commonly linked with parasitic infections, such as worm infestations, its causes extend beyond these. In the realm of liver diseases, erythema frequently appears as a symptom. This includes a spectrum of conditions like cirrhosis, acute viral or autoimmune hepatitis, and diseases affecting the gallbladder. It's critical to recognize that erythema is not a standalone symptom, rather, it often signals more serious underlying health issues. Specifically in liver diseases, erythema may manifest as the body's response to various complications or deteriorating liver function. Furthermore, it's important to acknowledge that erythema can also arise from adverse drug reactions. Statistically, 1 in 10 such reactions can lead to severe liver intoxication. This underscores the importance of considering erythema not just as a skin condition, but potentially as a symptom of more severe health concerns, particularly in relation to liver function. Sign number 4, itching. The sensation of itching in the lower part of the feet, while often dismissed as a minor discomfort, can actually serve as a significant indicator of chronic liver diseases. This symptom is particularly common in conditions related to impaired bile duct function and obstructed bile flow. A notable example is primary biliary cirrhosis, a specific type of liver disease, where approximately 70% of affected individuals report experiencing itching in the feet or palms. This itching is primarily caused by the buildup of bile salts under the skin and an increase in histamine levels. Normally, the liver processes and eliminates bile efficiently. However, when liver function is compromised, bile salts may accumulate, leading to pronounced itching sensations. This symptom, therefore, is not just a source of discomfort but potentially signifies a more severe underlying liver condition. Recognizing and addressing this symptom is crucial in the assessment and management of overall liver health. Sign number 5, reddish-brown spots on your legs. The appearance of reddish-brown spots on the legs, particularly below the knees, warrants attention as it may be indicative of underlying health concerns. These spots, often small and varying in size, may exhibit a chain-like pattern and show a noticeable shine under direct light. Their presence is commonly associated with problems in blood circulation and a decline in vascular health. Such skin changes can be a sign of liver insufficiency, a condition characterized by reduced blood pressure in the arteries and the enlargement of blood vessels. In the context of liver diseases like hepatitis, these distinctive spots may emerge either shortly after the initial infection or as the illness evolves into a chronic state. Recognizing these skin changes is vital, as they can act as early warning signs of serious liver-related health issues. It is important for individuals to be vigilant about such symptoms and to seek medical evaluation and intervention, as these spots can provide crucial insights into the overall state of liver health and general well-being. Sign number 6, swelling of the feet. Swelling or edema in the feet is a notable symptom often linked to liver diseases. This condition, marked by the accumulation of fluid within the tissues, is readily identifiable. A key characteristic is when pressure applied to the swollen area with a finger leaves a lasting indentation, which slowly reverts to its normal state. This symptom, typically more pronounced in the evening or after physical exertion, is considered a later stage sign associated with conditions like portal hypertension or a reduction in albumin levels. In cases of cirrhosis, where normal blood flow through the liver is obstructed, swollen feet are a common observation. This obstruction leads to increased pressure in the portal vein, subsequently causing fluid to accumulate in the legs and abdomen. Additionally, swollen feet can also signal kidney-related issues, such as nephrotic syndrome, which may arise as a secondary complication of viral liver inflammations like hepatitis. The close relationship between the health of the liver and the swelling of the feet highlights the significance of this symptom. It is essential to recognize and address such swelling, as it can be a marker of serious liver or kidney conditions, necessitating prompt medical attention and intervention. Awareness of liver damage symptoms is crucial, and understanding the causes of liver problems is equally important. Let's explore the common causes and then delve into 5 steps to help repair and restore your liver. Firstly, consuming alcoholic beverages damages hepatic liver cells, as the liver is tasked with removing alcohol from your blood. Another significant cause of liver damage is the excessive intake of sugar, refined grains, and carbohydrates, which contribute to non-alcoholic fatty liver disease, often accompanied by weight gain around the stomach. Additionally, certain medications and painkillers, including statins and antibiotics, can harm the liver and kidneys due to their role in chemical removal from the blood. Moreover, common vegetable oils, margarines, and salad dressings, typically made from highly processed seed oils, can cause substantial inflammation in the liver. Replacing these with healthier fats like extra virgin olive oil or raw coconut oil is advisable. Lastly, a diet high in protein and low in vegetables can exacerbate liver damage by causing a buildup of nitrogen waste. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Is fatty liver dangerous? How can you recognize the early and advanced symptoms of hepatic steatosis, a silent yet serious threat? What are the key signs indicating that the fat in your liver has reached concerning levels? And more importantly, what steps can you take to eliminate this fat before it becomes too late? Today, we delve into the topic of fatty liver disease, a condition that is rapidly increasing worldwide. In the 1990s, hepatic steatosis was relatively rare. Nowadays, it is far more common than you might realize, even affecting children. In the United States alone, over 30% of adults over the age of 35 are afflicted. This is not a benign condition. Untreated, it can lead to liver scarring, cirrhosis, and even liver cancer. To grasp the severity of this issue, consider that hepatic steatosis is one of the leading causes of liver transplants globally. Ignoring this condition is not an option. Timely detection is crucial because the liver possesses a remarkable ability to regenerate, but only up to a certain point. By recognizing the signs and symptoms early, you can halt the disease's progression. Remarkably, you can even reverse fatty liver, restoring your liver to a healthy state. But it's not just about recognizing the symptoms. Understanding the main dietary causes of liver fat is essential. If you suspect or know you have fatty liver, avoiding certain foods entirely is imperative. I'll also share how you can naturally combat this condition through lifestyle changes. Surprisingly, some of the best remedies for fatty liver might already be in your kitchen, not in your medicine cabinet. So, let's get started. What are the 17 symptoms of fatty liver that you cannot afford to ignore? We'll explore 6 initial symptoms and 11 more severe complications, underscoring the urgent need for medical attention. First, a crucial point: hepatic steatosis is often silent. Many people discover they have fatty liver by chance during an ultrasound or a blood test conducted for another reason, where elevated liver enzymes such as AST and ALT are detected. This can be shocking, especially since early-stage hepatic steatosis does not exhibit symptoms similar to other conditions like diabetes, high cholesterol, or high blood pressure. But don't despair if you've been diagnosed with this condition. In its initial phase, fatty liver disease can be completely reversed, thanks to the liver's incredible regenerative capacity. So, were you really feeling nothing at all? Let's go to the symptoms. 6 initial symptoms of fatty liver. First initial symptom: stomach pain and heartburn. A study from UFMG revealed that individuals with hepatic steatosis often experience dyspeptic symptoms such as heartburn, burning sensations that extend from the chest to the throat, belching, and a persistent feeling of a full stomach. These symptoms occur significantly more in individuals with fatty liver, 25% compared to 12.4% in those without the condition. Second initial symptom: excess gas. Those suffering from hepatic steatosis frequently deal with excessive gas accumulation. Radiologists have noted that the presence of fat in the liver can contribute to this issue, sometimes even hindering the visualization of the pancreas during exams. This excess gas is likely due to changes in the intestinal flora, which directly impacts liver health. Third initial symptom: pain on the right side of the abdomen, near the ribs. This discomfort is often felt in the upper right quadrant where the liver is located, manifesting as a nagging pain under the rib. The liver's increased size can press on the phrenic nerve, causing pain around the right shoulder as well. Fourth initial symptom: loss of appetite. Loss of appetite among those with fatty liver can stem from metabolic changes, liver inflammation, and hormonal imbalances. Symptoms like nausea, abdominal discomfort, and psychological impacts contribute to a reduced desire to eat. These factors, linked to impaired liver function, disrupt the regulation of hunger and overall well-being, underscoring the need for medical follow-up and proper management. Fifth initial symptom: fatigue. The liver, an essential organ, plays a crucial role in metabolizing nutrients and generating energy. However, the presence of fat in the liver can significantly impair these functions. Moreover, steatohepatitis, a condition where liver inflammation accompanies fat accumulation, can intensify feelings of tiredness. This liver dysfunction also affects hormone production, impacting mood, sleep, and overall energy levels, leading to persistent fatigue. Sixth initial symptom, nausea. Nausea in cases of fatty liver or hepatic steatosis arises from various reasons linked to impaired liver function. The liver's reduced ability to filter toxins leads to the accumulation of harmful substances in the blood, causing nausea. Additionally, excessive fat in the liver can result in inflammation, bringing about abdominal discomfort or pain accompanied by nausea. Liver dysfunction also impacts digestion, particularly bile production, which is essential for fat digestion. Finally, liver enlargement can press on the stomach and other organs, creating a sensation of fullness and nausea. These symptoms reflect an inadequately functioning liver and typically suggest initial hepatic steatosis. Now, what are the 11 late symptoms of fatty liver that you cannot ignore? First late symptom, dark urine. In hepatic steatosis, the urine darkens because the affected liver releases more bilirubin into the bloodstream. This bilirubin is filtered by the kidneys and excreted in the urine, increasing its concentration and giving it a darker color, similar to cola. Second late symptom, white nails. White nails, also known as leukonychia, can be a sign of liver problems like cirrhosis or hepatitis. This change in nail coloration occurs due to changes in blood composition and circulation often associated with liver diseases. The liver's inability to process and eliminate toxins efficiently affects various systems, including the blood circulation under the nails, leading to pale or white nails. Third late symptom, red spots all over the body. When the liver fails to produce essential proteins for blood clotting, it can lead to a decrease in platelets known as thrombocytopenia and problems in the absorption of fat-soluble vitamins, including vitamin K. This deficiency is vital for clotting, and as a result, red spots may appear on the skin, signaling these hepatic problems. Fourth late symptom, spider veins. Hormonal imbalances caused by liver issues can lead to an increase in estrogen, which is not adequately processed. This excess estrogen causes the expansion of blood vessels, resulting in spider veins. This symptom indicates a problem with hormonal balance affecting blood circulation. Fifth late symptom, itching all over the body. In advanced liver disease, bile salts accumulate in the blood and deposit on the skin, causing intense itching. This itching is more common on the palms of the hands but can spread all over the body, causing significant discomfort. Sixth late symptom, jaundice. Jaundice occurs due to the accumulation of bilirubin, a yellow pigment produced by the breakdown of red blood cells. Normally, the liver processes bilirubin, but if there is liver dysfunction, biliary obstruction, or an increase in the destruction of red blood cells, bilirubin accumulates, tinting the skin and eyes yellow. Seventh late symptom, pulmonary erythema. Pulmonary erythema occurs due to the dilation of blood vessels in the palms of the hands. This characteristic redness can reflect various conditions, including hormonal changes or liver problems like hepatic steatosis. Damaged liver function leads to a hormonal imbalance causing blood vessel dilation. Eighth late symptom, pale stools. In hepatic steatosis, the liver doesn't properly process bile salts, which are essential for stool coloration. As a result, stools become paler, reflecting the liver's difficulty in performing its normal functions. Ninth late symptom, night blindness. Night blindness, or nyctalopia, can occur due to poor absorption of vitamin A, essential for eye health. The liver plays a crucial role in storing and metabolizing vitamin A. Liver disease compromises this ability, leading to a deficiency that affects vision in low-light conditions. 10th late symptom, gynecomastia. Gynecomastia, characterized by the enlargement of breast tissue in men, can be an indirect consequence of hepatic steatosis. The accumulation of fat in the liver interferes with the hormonal balance between estrogen and testosterone, leading to the development of feminine characteristics such as gynecomastia. 11th late symptom, pain on the right side of the abdomen, near the ribs. This discomfort is felt in the upper right quadrant where the liver is located. The liver's increased size can press on the phrenic nerve, causing pain around the right shoulder as well. This pain reflects the liver's enlarged state and underlying issues. That's why it's crucial to recognize the symptoms and address them promptly, even if you don't have any symptoms but possess risk factors for hepatic steatosis. How can you determine if you have fatty liver? Early detection of hepatic steatosis allows for complete reversal, safeguarding the liver from damage. Even when scars and fibrosis are present, progression to more severe issues like cirrhosis and liver cancer can be prevented. Diagnosis typically involves imaging tests such as ultrasound, CT scan, or MRI. While it's normal for the liver to contain a small amount of fat, exceeding 5% of its weight prompts noticeable changes in the images, indicating excessive fat accumulation in the liver. There are 3 degrees of hepatic steatosis: Grade 1, mild steatosis; Grade 2, moderate steatosis; and Grade 3, characterized by a large accumulation of fat in the liver. Who is more likely to develop fatty liver, and what are the risk factors? First risk factor, obesity. Obesity significantly increases the risk of hepatic steatosis, where excess fat accumulates in the liver. This excessive fat impairs liver functions and causes inflammation. Over time, this inflammation can worsen, leading to scarring of the organ. This scarring is worrisome, as it can progress to more serious conditions, including hepatic cirrhosis, severely compromising liver health and its essential functions. Second risk factor, type 2 diabetes. Individuals with type 2 diabetes face a higher risk of developing hepatic steatosis, a condition linked to insulin resistance, a central aspect of this disease. This resistance results in an abnormal accumulation of fat in the liver, negatively affecting its functions. This situation can progress to liver inflammation, increasing the possibility of more severe liver damage. Third risk factor, high blood pressure. People with high blood pressure have a higher risk of developing hepatic steatosis, as hypertension can contribute to the accumulation of fat in the liver. High blood pressure often coexists with other risk factors like obesity and insulin resistance, which together exacerbate the possibility of liver damage. Fourth risk factor, excessive alcohol consumption. Excessive alcohol consumption significantly increases the risk of hepatic steatosis. Alcohol is metabolized in the liver, causing oxidative stress and inflammation. This process leads to the accumulation of fat in liver cells, impairing their functions and potentially evolving into more severe conditions, such as cirrhosis and liver failure. Fifth risk factor, sedentarism. Sedentarism increases the risk of hepatic steatosis, as a lack of physical activity contributes to the accumulation of fat in the body and liver. Physical inactivity is also associated with other risk factors like obesity and insulin resistance, exacerbating the likelihood of liver damage. Other causes include the use of medications like amiodarone, diltiazem, tamoxifen, and corticosteroids. What can be done to reverse the fat in your liver? Essential steps to reverse fatty liver disease. First, exercise regularly. Currently, fatty liver has become a common problem in children, partly due to lifestyle changes. In the past, children remained active despite an inadequate diet, engaging in activities like riding bicycles. Today, the preference for electronic games has replaced actual physical activities. To combat this, it's recommended to engage in walks or other moderate activities for at least 150 minutes per week. Second, lose weight. By losing 5% of your weight, you can achieve significant benefits for your liver health, including reducing inflammation, fibrosis reduction, and decreasing hepatic fat, thus improving your overall health. Third, avoid alcohol. Reducing or avoiding alcohol consumption is essential to protect the liver. Alcohol damages liver cells, known as hepatocytes, and can lead to the accumulation of fat in the organ, compromising its function and health. Fourth, maintain a healthy diet. The health of our liver is closely linked to our diet. Often, an inadequate diet leads to fat accumulation in this organ. Fortunately, a balanced diet can be the key to reversing this condition. What are the 5 most toxic foods for your liver that you should avoid at all costs if you have fatty liver? First, ultra-processed foods. These include packaged foods and fast foods, which are detrimental to liver health. Avoiding ultra-processed foods is crucial to prevent fatty liver, as they contain high levels of sugars, saturated fats, and additives that increase the risk of hepatic steatosis. Second, refined wheat. Foods such as bread, pasta, and crackers increase fat in the liver. Avoiding refined wheat helps prevent fatty liver, as it can rapidly elevate blood sugar levels, contributing to insulin resistance and the accumulation of liver fat. Third, foods containing fructose. It's important to clarify that fresh fruits are not included. The biggest villain of all, causing the most fatty liver, is corn syrup and fructose, found in sodas, cereal bars, boxed juices, tomato sauce, ketchup, mustard, and jellies. Fourth, sugar. To maintain liver health, it's essential to reduce sugar consumption, including fructose. Sugar significantly contributes to fat accumulation in the liver, raising the risk of developing hepatic steatosis, a condition that negatively affects liver function. Fifth, vegetable oils. Today's diet is rich in omega-6, which causes inflammation, and poor in omega-3, which reduces inflammation. It's advisable to avoid vegetable oils, as many are rich in omega-6 fats, which in excess can promote inflammation and contribute to the accumulation of fat in the liver. And now, the 6 foods you should include in your diet to cleanse the fatty liver. First, turmeric. Turmeric, known for its anti-inflammatory properties, should be consumed with a pinch of black pepper to enhance its absorption and effectiveness in our body. Second, whole grains. Whole grains such as oat bran, flaxseed, and chia are rich in fiber and omega-3 and are associated with a reduced risk of hepatic steatosis. Third, coffee. Coffee, containing caffeine, tocopherol, vitamin E, and chlorogenic acid, acts as an antioxidant, reducing liver inflammation and offering protection against liver fibrosis. Fourth, olive oil. Consuming 3 to 4 tablespoons of olive oil daily can significantly reduce fat accumulation in the liver, promoting an improvement in liver health. Fifth, fruits. Research indicates that fruits, especially avocado, are effective in reducing liver fat. Avocado stands out due to its high content of glutathione, a powerful antioxidant that fights fat in the liver and promotes broader liver health. Sixth, cruciferous vegetables. Cruciferous vegetables like broccoli, Brussels sprouts, and cauliflower contain sulforaphane, which helps reduce liver inflammation and cancer risk, thanks to its sulfur derivative. If you have fatty liver, follow these guidelines. Thank you for watching. Don't forget to subscribe to the channel. See you in the next video. Common signs and symptoms of liver cancer. The liver, an organ frequently affected by tumors. It's not only a common site for metastasis from various cancers but also prone to developing primary liver cancer. Notably, liver tumors often manifest specific symptoms, aiding in early detection and prevention. In this video, we will delve deeper into the common symptoms of liver tumors. First, we'll look at the imbalance in liver function, evidenced by signs like jaundice, loss of appetite, and unexplained weight loss. These symptoms typically arise when the liver fails to filter and process toxins, indicating that tumor growth might be exerting pressure on or damaging liver cells. Next, we will analyze the sensation of pain or discomfort in the upper right abdomen, where the liver is located. The growth of a tumor can put pressure on surrounding organs, leading to inexplicable pain or discomfort. This could be an early warning sign of tumor development. Finally, we'll discuss the causes leading to the development of liver tumors. Factors such as chronic hepatitis, exposure to toxic substances, or excessive alcohol consumption can contribute to an increased risk of tumor development. Understanding these causes not only helps us in prevention but also aids in identifying effective treatment methods. Now, let's examine each specific sign in more detail. Situation 1. Incidental discovery of liver cancer. As health professionals, we often encounter cases where liver cancer is incidentally discovered during diagnostic tests for unrelated reasons. The most common method of diagnosing liver cancer involves detecting it on an ultrasound or an abdominal CT scan, typically performed during routine checkups or as part of ongoing monitoring for other abdominal diseases. This incidental discovery is significant because liver cancer, especially in its early and sometimes even advanced stages, usually does not manifest any symptoms. Patients incidentally diagnosed with liver cancer often report only a slight decrease in appetite, a very nonspecific symptom, emphasizing the importance of regular health screenings. Situation 2. Enlargement of the liver due to tumor growth. In cases where a large tumor develops in the liver, an increase in the liver's size is observed. The liver, usually shielded by the lower ribs on the right side of the chest, becomes palpable below the last rib during abdominal examination as the tumor grows. This enlargement, while typically asymptomatic, can sometimes cause a sensation of weight or fullness in the abdomen. Due to its increased size, liver cancer is more readily observed in diagnostic tests like ultrasounds or CT scans, illustrating the critical role of imaging in cancer detection. Situation 3. Pain in the upper right abdomen. Liver cancer can induce pain in the upper right quadrant of the abdomen. This pain often presents as a sharp, sudden onset that rapidly intensifies. Typically, it originates from a rupture in one of the blood vessels associated with liver cancer, leading to internal bleeding. This bleeding causes abrupt stretching of the liver's capsule, Glisson's capsule, which activates the pain receptors in the liver. If there's no bleeding, and the tumor grows slowly, this stretching happens gradually, leading to low-grade nerve stimulation, and therefore less noticeable pain or discomfort. This situation highlights the need for vigilance in monitoring even minor abdominal discomforts. Situation 4. Jaundice. One of the hallmark signs of liver cancer is jaundice, where the skin and mucous membranes exhibit a yellowish tint. This occurs when cancer growth disrupts the normal outflow of bile in the liver. The trapped bilirubin then leaks into the bloodstream, elevating blood bilirubin levels. Excess bilirubin tends to accumulate in the skin and mucous membranes' elastic fibers, particularly noticeable in the sclera of the eyes. Understanding this phenomenon is vital for early recognition of liver pathology. Situation 5. Changes in urine and feces color. Liver cancer can also impact the liver's ability to process and eliminate bilirubin, leading to observable changes in urine and feces. Increased direct bilirubin in the liver spills into the bloodstream and is subsequently excreted through the urine, resulting in a darker, cola-like color. Conversely, when bilirubin cannot access the small intestine, its natural pathway, this inhibits the formation of urobilinogen, the pigment that colors stool. As a result, feces may become increasingly pale, and in cases of total bile outflow obstruction, they may turn white. These changes in excretory products are critical diagnostic clues in assessing liver function and health. Situation 6. Ascites due to altered portal venous circulation. In the realm of liver oncology, we often encounter a condition known as ascites, a direct consequence of liver cancer affecting the portal venous system. This system, crucial for transporting blood from abdominal organs to the liver, faces increased pressure when disrupted by liver cancer. As a result, fluid escapes from these vessels and accumulates in the peritoneal cavity, leading to abdominal swelling. In severe cases, the volume of acidic fluid becomes so significant that it necessitates medical drainage. This is because excessive fluid can elevate the diaphragm, impeding lung expansion and causing considerable respiratory distress. Patients with this condition often experience marked difficulty in breathing due to restricted air entry into the lungs. Situation 7. Fever, fatigue, and weight loss. As liver cancer progresses, it behaves like a parasitic entity within the body, siphoning energy from the host's nutritional intake. This phenomenon, common to many cancers, results in the rapid turnover of tumor cells, a process markedly faster than that of healthy cells. Consequently, our bloodstream becomes inundated with debris from these dying cells. This can lead to systemic intoxication, manifesting as fatigue and weight loss, as the body struggles to cope with the increased metabolic demands and toxin clearance. Furthermore, the presence of these cellular fragments in the bloodstream can interfere with the brain's thermoregulatory center. When these fragments pass through this area, responsible for body temperature regulation, they can induce mild fever by disrupting the normal neuronal activity within this center. Situation 8. Skin rash. In the clinical spectrum of liver cancer, one symptom that often goes underrecognized is the development of skin rashes. These dermatological manifestations can be a direct consequence of the systemic impact of liver cancer on the body's immune and metabolic systems. When the liver, a vital organ for detoxification and metabolism, is compromised by cancer, it can lead to an accumulation of toxins and metabolic byproducts in the bloodstream. These substances can trigger inflammatory responses in the skin, presenting as rashes. From a medical standpoint, these rashes can vary in appearance, ranging from small, pinpoint red spots known as petechiae, which result from minor hemorrhages, to larger patches of discolored skin. In some cases, the rashes may be pruritic, causing significant itching and discomfort. This itching is often a result of the accumulation of bile salts in the skin due to impaired liver function. We have seen the symptoms that can cause liver cancer when it has grown within the liver itself. And what happens when the tumor escapes outside the liver? Which are the ways it can escape? What symptoms can occur if it escapes? Let's answer these questions. When the tumor is already outside the liver, maybe because it has escaped by one or more of these 4 ways. Liver cancer grows so much that it infiltrates neighboring organs and structures. Tumor breaks the peritoneum and spreads through the abdominal cavity. Liver cancer escapes through the lymphatics. Or tumor cells enter the blood. Let's see where each of these 4 ways leads liver cancer cells. Situation 1. Tumor growth and infiltration of neighboring structures. When liver cancer reaches a significant size, it has the potential to infiltrate adjacent organs, such as the gallbladder, right adrenal gland, or the large intestine. Notably, it may also extend upwards to infiltrate the diaphragm, the muscle delineating the chest and abdominal cavities. This expansive growth can disrupt the gallbladder and bile ducts, impeding bilirubin elimination. Consequently, patients may experience intensified symptoms like pale stools, dark urine, and aggravated jaundice. Additionally, diaphragmatic irritation by the tumor can lead to persistent hiccups, a symptom that can severely diminish the patient's quality of life. Situation 2. Peritoneal spread and peritonitis. As the tumor enlarges, it may breach the liver's capsule and spread into the peritoneal cavity. Here, cancer cells can disseminate and implant on the surfaces of various abdominal organs. This process can result in symptoms of peritonitis, characterized by diffuse abdominal pain due to peritoneal irritation. When these tumor implants compress the small intestine from the outside, they can cause bowel obstruction, leading to symptoms like subocclusion or complete intestinal obstruction. Situation 3. Lymphatic spread and biliary compression. Liver cancer can also metastasize via the lymphatic system. Initially, cancer cells often accumulate in the lymph nodes around the hepatic hilum, where the liver's blood vessels and bile ducts converge. This nodal involvement can lead to symptoms of bile duct compression, blocking bile flow and causing an increase in blood and urine bilirubin levels. The feces may lose their brown color, appearing pale or white. Subsequently, cancer cells can spread to more distant lymphatic regions, though these metastases may not always produce noticeable symptoms. Situation 4. Hematogenous spread to lungs and bones. Another pathway for liver cancer metastasis is through the bloodstream. Once inside the blood vessels, cancer cells can travel to distant sites like the lungs and bones. Lung metastases often present as multiple nodules and can lead to symptoms like breathing difficulties, persistent dry cough, and in some cases, hemoptysis if a blood vessel is involved. Bone metastases, on the other hand, can cause severe pain, particularly if the tumor invades and disrupts the periosteum or compromises the structural integrity of weight-bearing bones. Vertebral involvement can lead to back pain and, in severe cases, spinal cord compression syndrome, presenting with various neurological symptoms. As demonstrated, liver cancer's progression, whether within the liver or metastasized to distant sites, can manifest a plethora of signs and symptoms, necessitating a vigilant and comprehensive approach in its diagnosis and management. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Hello everyone. Welcome to Healthy Care. If you're over 50 and often feel tired, struggle to manage your weight, especially around the middle, or deal with sluggish digestion, then your liver might be the hidden culprit. The good news? You can start improving your fatty liver in just 2 weeks with the simple dietary approach. It's easier than you might think. Let's dive in and learn how to get your liver back on track. Don't forget to hit the subscribe button and leave a comment about why you'd like a copy of our best-selling book. This morning, we're going to take a closer look at the liver, the body's main detox manager. Everything that enters your body goes through the liver first, and everything that leaves is under its control. So let's start by looking at what enters the body and how the liver processes it. Let's take a closer look at what we're putting into our bodies. Never in history have people consumed so many carbohydrates. Our diets are flooded with them, and we've become high-carb consumers without even realizing it. Picture any supermarket entire aisles are dedicated to bread, cereal, pasta, and a huge selection of cakes, pastries, muffins, cookies, and biscuits. And it's not just sweets. Carb-heavy foods like pizza, rice, and all kinds of potato products, from French fries to chips, are in abundance. But here's where we run into trouble. These foods might be convenient and delicious, but they are far from the best choice for our bodies, especially our liver. On a farm, fast food is truly natural, like fresh fruits and vegetables straight from the earth, packed with nutrients. In contrast, most high-carb foods go through heavy processing and refining, leaving little in the way of nutritional value and placing an unnecessary burden on our digestive system. When we eat these carbs, our digestive tract breaks them down into a simple sugar called glucose. This glucose is quickly absorbed into the bloodstream and heads straight to the liver via the portal vein, like traffic heading down a major highway. Here's where the liver steps in as the project manager of our body's fuel, deciding where that glucose should go next. Normally, glucose is distributed to cells for energy, following a 20-step process that releases 2 units of energy. This process eventually produces pyruvate, which is then sent to the cell's mitochondria, known as the powerhouse of the cell. Inside the mitochondria, it undergoes another 8 steps, producing 36 units of energy. This process sounds efficient, but too much glucose can start to weigh the liver down. Our liver is a powerhouse of detoxification, filtering every substance that enters the body. Yet here's the reality: our high-carb diets are overwhelming this vital organ. Supermarkets are stacked with carbohydrate-rich foods like bread, pasta, and sugary snacks that flood the liver with glucose. With so much to handle, the liver often converts the excess glucose to fat, leading to the rapid development of non-alcoholic fatty liver disease, a condition becoming all too common and often undetected. What many don't realize is that common foods like pizza, chips, and even rice deliver more glucose to the liver than it can effectively manage. Liver, which should focus on detoxifying the body, ends up drowning in fat instead. But here's the good news: a diet rich in fruits and vegetables offers an entirely different story. These natural foods support the liver by aiding detoxification and providing nutrients, rather than adding to fat storage. The time has come to rethink our eating habits. By reducing high-carb foods and replacing them with nutrient-dense, natural options, we give our liver a chance to rest, recover, and perform its best. The liver has an amazing capacity to heal, but only if we act with purpose. Cutting back on carbs and choosing natural foods could be the key to revitalizing this essential organ and restoring balance to our health. 1 dandelion. Dandelion has long been recognized as a powerful herb for supporting liver health, earning its place as the king of liver herbs. Although it has a very bitter taste, this bitterness is actually a key to its health benefits. Unlike sugar, which may be sweet to the mouth, but ultimately taxing to the digestive system, bitter herbs like dandelion have the opposite effect. They stimulate and benefit digestion. The bitterness of dandelion promotes the release of digestive enzymes from both the liver and stomach, helping the body process nutrients more effectively. The liver is unique among organs for its remarkable ability to regenerate. It's the only organ in the human body that can regrow after injury, which is why even a partial liver transplant can be effective. The liver tissue can regenerate to restore its function. This regenerative ability, however, needs support, especially given the stresses modern diets place on this essential organ. Dandelion provides the liver with essential support, promoting detoxification and encouraging tissue regeneration, which can help maintain the liver's optimal function. A well-functioning liver can also be a protective factor against certain diseases, including cancer, as it plays a major role in clearing out toxins and maintaining cellular health. Dandelion can be easily incorporated into the diet in several ways. In European cuisine, dandelion is often used in dishes like hot potato salad. This dish involves combining warm potato chunks with chopped dandelion leaves, olive oil, crushed garlic, and salt, creating a balanced and flavorful way to enjoy this herb's benefits. The olive oil complements the bitterness of the dandelion, while the garlic adds a subtle depth, making the dish both delicious and nutritious. For those who prefer to drink their herbs, dandelion root can be roasted to create a warm, coffee-like beverage often referred to as chai dandelion. Unlike traditional teas, chai dandelion is caffeine-free and provides a blend of earthy, herbal flavors with hints of spices. Many who find traditional herbal teas bland enjoy the richness of chai dandelion. This drink is a fantastic choice for those looking to support liver health naturally, as roasted dandelion root has been shown to stimulate bile production, aiding the liver in breaking down fats and promoting detoxification. Dandelion offers a potent, natural approach to supporting liver health. Its unique bitterness stimulates essential digestive processes, while its compounds encourage liver detoxification and regeneration. Unlike sugar-laden foods, which can strain and damage the liver over time, dandelion provides nourishment that promotes liver health and overall well-being. 2 lemon and lemons, often recognized for their acidic taste, actually have a remarkable alkalizing effect on the body once metabolized, making them an ideal natural support for liver health. Although the juice itself is acidic, its alkaline-forming minerals potassium, calcium, magnesium, sodium, and iron help balance the body's pH when processed. This alkalizing effect is particularly beneficial for the liver, as maintaining a balanced pH promotes an optimal environment for liver function. The liver plays a critical role in producing bile, a digestive fluid essential for breaking down fats, absorbing fat-soluble vitamins, and flushing toxins. Starting the day with a glass of warm lemon water helps stimulate bile production, giving the liver a gentle push to detoxify effectively. This daily ritual can support the liver's natural processes and promote healthy fat metabolism. To maximize lemon's benefits, simply squeeze half a lemon into a cup of warm, not boiling water in the morning. This simple lemon water tonic not only hydrates but also encourages the body's digestive system to start functioning efficiently. Hydration alone is essential for liver health, as it helps maintain optimal blood flow, making it easier for the liver to filter out toxins and improve overall cellular function. In addition to supporting digestion, lemon is rich in vitamin C and antioxidants. Vitamin C is essential for immune health and acts as a powerful antioxidant, combating free radicals and reducing oxidative stress on the liver. This is particularly valuable for individuals whose diets are high in sugar or fats, which can lead to increased oxidative stress. The antioxidants in lemons protect liver cells from potential damage, giving the liver a better chance to repair and regenerate itself. Another advantage of lemon is its ability to aid the liver in balancing the body's blood sugar levels. By regulating glucose absorption, lemon can help ease the liver's workload, especially for those with diets high in processed carbohydrates. This balance allows the liver to focus on its primary functions, like detoxification and bile production, without being overwhelmed by excess sugars. Lemon is much more than a flavorful addition to your diet, it's a natural powerhouse for liver health. Regularly consuming lemon water can help maintain the body's pH balance, support bile production, reduce oxidative stress, and assist in blood sugar regulation. This simple morning habit offers substantial benefits, helping the liver to detoxify, rejuvenate, and function at its best. Embracing lemon as part of your daily routine can be a significant step toward a healthier liver and overall well-being. 3. Turmeric. Turmeric, renowned for its vibrant yellow color and distinctive flavor, is a powerful herb known for its ability to reduce inflammation throughout the body, making it particularly beneficial for liver health. But chronic inflammation is a significant contributor to liver damage and conditions like fatty liver disease. And turmeric's active compound, curcumin, is especially effective in addressing this issue at a cellular level. For anyone seeking natural liver support, turmeric is a valuable addition. Curcumin, the primary bioactive component in turmeric, has been shown to reduce inflammation by inhibiting inflammatory pathways within cells. This anti-inflammatory action is vital for individuals with fatty liver disease, as the liver's environment in such conditions is often highly inflamed. By reducing inflammation, curcumin helps slow the progression of liver damage, allowing the liver to function more efficiently in promoting cellular repair. In addition to reducing inflammation, turmeric supports heart health, improves digestion, and offers antioxidant protection against oxidative stress. Oxidative stress occurs when there is an imbalance between free radicals and antioxidants in the body, which can lead to cellular damage in the liver and other organs. Curcumin's antioxidant properties neutralize free radicals, protecting the liver cells from further damage and promoting a healthier liver environment. For optimal effects, turmeric can be consumed in various forms. A simple and effective way to incorporate turmeric into your routine is by making turmeric tea. To prepare, add a teaspoon of dried turmeric powder to boiling water, along with a pinch of black pepper to enhance curcumin absorption. Black pepper contains piperine, a compound that increases curcumin's bioavailability by up to 2,000%, allowing the body to absorb and benefit from curcumin more effectively. Let the mixture steep, Then enjoy this warming tea as a daily addition to your liver-supporting regimen. The recommended dose for dried turmeric is around 1 teaspoon, 3 times daily. For fresh turmeric, a higher amount is needed due to the water content. So the recommended dose is about triple that of dried turmeric. Consistency is key, and regular use can provide long-term benefits for reducing inflammation and supporting liver health. Turmeric is much more than a culinary spice, it's a powerhouse for liver health. With its potent anti-inflammatory and antioxidant properties, turmeric, and specifically curcumin, helps protect the liver, combat inflammation, and reduce oxidative stress. Including turmeric in your daily routine, whether in tea form or as a supplement, it can be a natural and effective way to support liver detoxification, reduce inflammation, and maintain overall wellness. 4. Ginger. Ginger, a versatile herb widely used for centuries, offers numerous health benefits for both internal and external use. Known primarily for its anti-inflammatory and anti-nausea properties, ginger is a go-to natural remedy for issues like car sickness, seasickness, and digestive discomfort. Its potent compounds make it an excellent choice for supporting liver health as well. Internally, ginger's anti-inflammatory effects are particularly beneficial for individuals with liver conditions like fatty liver disease. Inflammation is a common component of fatty liver, and ginger's active compounds, including gingerol and chagal, work to reduce this inflammation, creating a healthier environment for liver function. Additionally, ginger is known to stimulate bile flow, which is crucial for breaking down fats and aiding in the digestion and absorption of nutrients. By promoting bile production, ginger helps the liver manage fat metabolism, reducing fat buildup and promoting natural detoxification. For regular use, ginger can be enjoyed as a tea. A simple preparation involves grating about a teaspoon of fresh ginger, placing it in a teapot, and pouring boiling water over it. Let the tea steep for around 10 minutes to allow the ginger's beneficial compounds to infuse the water. This tea can be quite strong, so those who prefer a milder taste may choose to dilute it. Drinking warm ginger tea not only aids in digestion and alleviates nausea, but also serves as an effective warming remedy, particularly helpful for people who feel chilled. Beyond its digestive and warming effects, ginger is also soothing for sore throats and can support vocal health, hence its popularity among singers and speakers. Its anti-inflammatory properties help reduce throat irritation, making it useful for anyone experiencing voice strain or discomfort. For liver health, the benefits of regular ginger tea consumption are particularly notable. By supporting bile production and reducing inflammation, ginger aids the liver in breaking down fats more efficiently, which is essential for those with fatty liver. Additionally, the natural detoxifying effects of ginger help the liver clear out toxins, promoting overall liver health and contributing to improved metabolic function. In summary, ginger is a powerful herb that provides multifaceted support for liver and digestive health. Whether used to alleviate nausea, stimulate bile flow, or reduce inflammation, ginger offers a simple yet effective way to support the body's natural detoxification processes. Adding a daily cup of ginger tea to your routine can provide meaningful benefits, particularly for liver function and digestive comfort. 5. Butter. Contrary to popular belief, butter and other natural fats like cream and eggs are not the villains when it comes to cholesterol and liver health. In fact, a high carbohydrate diet, which constantly spikes insulin levels, places a far greater strain on the body. When diets are heavy in glucose-rich foods, the pancreas is forced to work overtime, producing insulin to manage blood sugar. This ongoing demand exhausts the pancreas, contributing to insulin resistance and metabolic stress, which can lead to high cholesterol, fatty liver, and other health issues. Butter and similar natural fats, on the other hand, offer essential nutrients without causing insulin spikes. When people reduce carbohydrate intake and replace it with healthy fats, like those found in butter and eggs, the pancreas can finally rest, allowing insulin levels to stabilize. In this way, cholesterol levels often return to healthier ranges without the need to avoid these nutrient-rich foods. Research has shown that cancer cells rely heavily on glucose for survival, consuming it at a rate far higher than normal cells. By significantly reducing high glucose foods, the growth environment for cancer cells is disrupted, and they may begin to starve. Dr. Atkins observed that his patients, when on low glucose diets, often experienced improved health, including a reduction in tumor growth. This finding underscores the value of essential foods like butter, cream, and eggs in supporting health. Unlike high-carb foods, these fats provide long-lasting energy and support cellular health without spiking insulin. Fiber also plays a crucial role in a balanced diet, especially for digestive health. It sweeps the gut clean, carrying waste out of the digestive tract while aiding in nutrient absorption. Even something as simple as eating potatoes with the skin on can increase fiber intake, as many nutrients are concentrated just beneath the skin. Fiber supports gut health, and by extension, the liver, as a healthy digestive system aids in the body's natural detoxification process. In reality, it's high-carb, high-sugar foods that pose a threat to cholesterol levels and liver health, not healthy fats. A diet rich in natural fats, along with fiber, provides essential nutrients without overburdening the liver or pancreas. Butter, eggs, and cream not only support overall health, but also maintain balanced insulin levels, and provide necessary fat-soluble vitamins. For individuals concerned about fatty liver or cholesterol, reducing carbs and embracing healthy fats could make a meaningful difference in their health journey. In short, natural fats are not only safe but beneficial, offering essential nutrients, promoting balanced insulin levels, and supporting liver health without increasing fat storage. By choosing nutrient-dense foods over high-glucose options, you support your body's natural healing and protective mechanisms. And there you have it, some straightforward, natural remedies that can start transforming your liver health in just 2 weeks. Your liver has an incredible ability to heal, but it can only do so with the right support. By making these small, impactful changes, you're not just helping your liver, you're taking a step toward a healthier, more vibrant life. If you enjoyed this content and found it valuable, please like, share, and leave a comment below. Don't forget to subscribe for more practical health tips and insights. Until next time, stay healthy and